All right, good afternoon. I'm Dan Gilman, Chief of Staff for Mayor Bill Peduto. Appreciate everyone coming as we provide you the latest update on the city's response to coronavirus. Mayor Peduto has been in Washington, D.C., meeting with CDC officials, other officials in the administration, and had extensive conversation this morning with the Department of State. As a result of those conversations, we can announce that the G7 Ministers Conference to be held in Pittsburgh has been canceled, and the Department of State will instead host a virtual meeting for ministers to attend. Additionally, as you know, after further consultation with other cities and the CDC, the mayor spoke directly with Mayor Walsh of Boston, Mayor Kenny of Philadelphia, and our office has been working with mayor staffs around the country. We have decided to cancel the St. Patrick's Day Parade. While an incredible tradition and a great opportunity for our community, the health and safety of our residents and our visitors must be our top priority at all times. Given the recommendations of the CDC on social distancing, it is in the best public health of the city of Pittsburgh and the region to cancel the parade at this time. I've spoken with parade organizers before the announcement and will continue to meet with them this week to talk about alternative options and plans for the future. Additionally, this morning, we've instituted an international travel ban on all City of Pittsburgh employees on official work travel, and a national travel ban without express written permission from myself for any work travel within the United States, which will be for essential employees on emergency basis only. Furthermore, we just announced a new ban on all City of Pittsburgh meetings that will anticipate an attendance of over 50 people. This is in accordance, again, with CDC recommendations on social distancing and keeping a buffer zone between individuals. Any meeting with an anticipated 50-person or greater attendance will be suspended until future notice. Lastly, I've been working very closely with Visit Pittsburgh, our business community, and the Pittsburgh professional sports team, in particular the Pittsburgh Penguins, who are of course in the middle of their season, talking about the safety of those large special events. They are coordinating between the NHL, Major League Baseball, the county health department, and other agencies, and the Pittsburgh Penguins will be making their own release this afternoon with further information about their crowds. Our number one recommendation continues to be, number one, if you are sick, stay home. Do not go to work, do not attend large events, stay home and recover. Number two, if you're part of an at-risk population, we encourage you to expressly practice our social distancing and protect yourself at all times. We'll continue to monitor the situation with our government partners and may very well be making additional announcements in the future. With that, I'd like to introduce our Public Safety Director, Wendell Hisrick, who along with Chief Operating Officer Kinsey Casey are running point on our coronavirus response. We'll talk a little bit more about this weekend. Director.
Thank you, Mr. Gilman. First off, I want to thank the members of the public safety community, not only here in the city, but in the county, the Allegheny County Emergency Services 911 call takers. They've been doing a great job, both in planning and as far as the call takers, screening calls that are coming in with individuals that think they may have the virus. We're taking this very seriously, as many of the other cities. As Mr. Gilman said, we've been in contact on the public safety side with the same cities and some additional cities as well. The important thing is to remember, as Mr. Gilman also stated, is if you stay home or if you feel ill, to stay home. Also, the elderly, those that may be more prone to being infected with the virus, should consider, even though that they may not feel ill, to stay home and stay away from crowds. Social distancing, as recommended by the CDC, is remaining out of congregate settings, avoiding mass gatherings, and maintaining distance of 6 foot or 2 meters from all others when possible. These are recommendations from the CDC and include all those, including those that are not prone to the virus. Today, Public Safety will be sending a letter to all the bar owners throughout the city, basically providing guidance and strongly urging the clubs, restaurants, and bars to consider lowering their occupancy rates so personnel have more space. We're currently checking with the legal department to see if we have any legal authority to being able to lower the occupancy rates that are already set in stone. I will say that the bar task force will be out in force on Saturday night, and depending on the occupancy rate at that time, if it is what it is now, it will be strictly enforced, and if they are one person over, the bar will be shut down for the remainder of the evening. Other recommendations of the bar owners stated in the letter include cleaning the bathrooms regularly, having soap and hand sanitizer available at all times, using disposable cups, keep high contact surfaces clean, and instructing their employees that if they feel ill, to stay home. We will maintain the porta-johns that we have had in previous years, and we will increase the hand sanitizer throughout the South Side area and Carson Street area. We've also added an extra shuttle between the 2nd Avenue parking lot and South Side with the hopes of decreasing the amount of personnel on each of the shuttles. As we're well aware, we have no cases in Allegheny County as of yet. The steps that we are instituting will hopefully slow down the rate as the virus spreads. These steps are absolutely necessary in order to keep the residents and visitors safe, which is our #1 priority. We've been working a plan for the last several months to include standing up additional EMS units, and I'll let Chief Lynn explain to you what the plan is. But once again, this may be one of the most challenging incidents or events that the City of Pittsburgh and public safety has faced. So with that, I will turn it over to Chief Lynn, and then we'll be able to answer some questions.
Thank you, Director. EMS has been working closely with our partners in the hospitals, as well as the local, state, and federal health organizations to be prepared for this instance. We are prepared to put on additional ambulances as needed. We also have a plan to test people and perhaps have them stay at home so they can be treated at home. In most cases with the coronavirus, there is no need to be hospitalized, so we would be encouraging people to stay at home when possible. Our staffing is such that we can put our crews on additional schedules so that we will have sufficient staff to staff these additional ambulances. Does anybody have any questions?
Yeah, can you talk a little bit more about that staying at home? So you're saying you respond to someone who's sick, and rather than transporting them to the hospital, part of the equation could be telling them you're better off staying here?
Correct. Yeah, if it's not a critical patient that would need definitive care in a hospital setting, we will be consulting with physicians, as we do on a regular basis, and provide a care plan for them to stay at home.
But Chief, you said test. What kind of test?
Well, right now the Centers for Disease Control is working on a test that would we be able to swab the inside of the mouth and send it out for testing.
But your crew's not going to know it immediately.
No, but we're going to have an idea based on symptoms and so forth. The key thing being fevers and respiratory ailments.
Any extra precautions for your crews as they go out? Any extra equipment facing? I mean, what exactly are you all doing to protect yourselves as well?
Well, yes, we do. I mean, first line of defense is, of course, our 911 center is doing the screenings to begin with, and we look at travel as well as the symptoms. Based on that, we've gone through additional training to help protect ourselves and use the masks and other means of barriers to protect our crews.
Our health systems, are they testing for the virus? We spoke with a couple of patients who said that their doctors advised them to get tested, but they weren't able to. So do you know of UPMC and Allegheny Network are testing?
I have not spoken with them recently, so I can't tell that. You'd have to ask them that.
Question? Director, I wanted to ask, the When you say you're advising patients to stay home, you're not limiting it just to coronavirus. You mean any medical condition where they can be at home. Is that correct?
Well, I mean, that would be part of the evaluation. We would go and evaluate these patients and...
No matter what they have.
Correct, yeah, it doesn't matter. You know, we do that on a regular basis anyways. You know, there are times whenever we'll say, you know, being at the hospital really isn't going to help you out. You're better off being at home.
In that kind of situation, when you say be at home, would you mean to be quarantined at home or not?
I mean, right now, we're following the Centers for Disease Control's mandates, their recommendations. They're suggesting that, you know, anybody who is sick stay at home. It's sort of self-quarantine themselves. There's no mandatory quarantine at this time.
Director.
When was the decision made officially? I mean, yesterday we talked to the organizers of the parade who said, we're still open to go. 24 hours later, canceled. When was the decision made? And can you talk a little bit about some of the internal discussions that took place leading up to the announcement today?
Sure. The decision was made about 15 minutes before the press release went out. We announced it immediately. We, of course, wanted to talk to the organizing committee before a release was made to the public. It's really been an ongoing process. I think it's important to stress that our team has been working on this now for 3 to 4 weeks, and in Director Hisrick and Public Safety's case, it probably goes back 6-7 weeks when they started some precautions just when we knew what was happening in Wuhan and wanting to prepare here. But we have an interdepartmental Delta team responding to this situation here and talking to not only other cities but national health experts. As I said, the mayor had very extensive conversations yesterday with administration officials in other cities, and watching the changing dynamic, the numbers in the country increase significantly day to day and hour to hour, seeing other city decisions and talking to them through their decision process and in consultation with the CDC has become abundantly clear that the most important thing we can do in this country is take bold and decisive action to stop large gatherings from taking place and practice social distancing. And so in a meeting this morning with senior administration officials and under the leadership of the director, we made the decision it was in the best interest to cancel.
Are there any concerns with the Home and Garden Show going on? Has anybody been in contact with them?
I've had some conversation this morning with Visit Pittsburgh, and we'll be talking with them this afternoon about a number of events. But again, we are largely deferring to the Allegheny County Health Department, who is the lead agency on many of those events that are outside the city purview.
You said that bar owners can expect a letter about occupancy and you want them to voluntarily lower occupancy. Is that something that the city could take stronger action?
Yeah, as I mentioned, we are discussing it with the law department to determine what legal authority that we do have. We're asking for them to voluntarily do it. And like I said, there will be absolutely no exceptions of going over the occupancy. And in the past, we would shut them down, empty the establishment out, and allow them to reopen. That will not occur on Saturday night. Once they're shut down for the evening. I think we've all visited the bars over there, and we know how close quarters they are. We know that St. Patrick's Day, there's a lot of hugging, kissing, and this could be problematic and lead to the spread of the virus, and that is serious concerns to us. So we will maintain a strong law enforcement presence. There will be obviously officers in uniform. There will be plainclothes officers, as well as the Bar and Nuisance Task Force in both the North Shore and South Side and other areas within the city. And also, while we're at it, you know, once again, I know it may be the least of the worries, but it is a worry about drinking and driving, and we caution people to drive, if you are coming out, to please drive sensibly. So,
Director, this Saturday night, for a lot of these, especially the more Irish bars, this is a huge financial night. Is there any sympathy or consideration?
well, there's a lot of sympathy. And I don't know, I know Ellison Herndon has been talking to other cities and their nighttime economy, nighttime economy personnel. And, you know, it's too soon to determine whether or not, you have a disaster, whether or not there'll be any reimbursement from the federal government down the road. But we realize it's a hardship, but right now the priority is keeping people safe and their well-being safe. And I mean, it was a very hard decision to cancel the parade. I mean, I know the parade was being in honor of Director Cannon, who I'm very fond of, so it hurts us to cancel the parade, but it is the right thing to do, and I think it's as seen through all the other cities. Chicago canceled this morning as well. The idea is try to slow this virus down and to limit its damaging effect on the population.
John, if I can just add too on John's point, I mean, the financial impact on this is incredibly real, obviously not only to the Irish bars, but to this country. We all know the stock market, what it's doing to the hotel industry, the airline industry, the cruise ship industry, and we're expecting to see it in numerous other industries as well. It's something we take tremendously seriously and worry greatly about the economic impact. That being said, public health and public safety have to always be our number one. And the best thing we can do is do this in partnership. And that's why this letter that will go out is so important. It talks about the role, not only from an occupancy perspective, the clientele has a responsibility. If you're sick, you got to stay home this weekend. You can't go out even if it's St. Patrick's Day. You have to stay home. Bars need to be washing their bathrooms every 30 minutes, using disposable cups. Those are important steps you can take to try to make it so they can continue to thrive economically, but not help spread this virus. So we'll continue to monitor and work with our partners, but there's going to be a significant economic hit to a number of industries in this country. And we continue to remain concerned about employees who have to stay home to take care of kids and other things like that. It's something we've been preparing for weeks on what's going to happen if significant shutdowns indeed occur the way they're being predicted to.
Dan, is there any thought to mandatory size limits or mandatory cancellations of public gatherings at all in the city?
I will say we are working closely, our law department, around the powers of the mayor and the public safety director, as well as under the governor, and certainly the county as well with the health department, if the need arises to take those steps. Right now we're working closely with entities that host those large events to practice social distancing. But if the next step needs to be taken, we're doing our research in partnership with other agencies to do that.
How did you come up with did you say 50 city meetings? That's city employees, right? 50 or more. How did you come up
It's not city employees. We're talking about community events that we expect that are city sponsored. So, we put out a press release just yesterday about a very exciting design charrette in the Manchester neighborhood. That's something we wouldn't do at this point until further notice to make sure that we can provide a safe environment for people to engage in their neighborhood, but not endanger their health.
How did you come up with that number, then?
So generally, the number the CDC's been using has been 250. That's obviously not an appropriate number for a room this size or a smaller. So it is somewhat of a number picked randomly, but trying to stay to an easy gauge of what 50 people looks like. But it's all around the goal of the 6 feet of social distancing.
And can you talk about the travel? Specify that one more time, please.
Sure. So for city employees, there will be no international travel whatsoever until further notice. And for any domestic travel, it is suspended without my written permission, which would only be essential personnel on emergency travel. And this is air travel.
Anything else?
In all of this, you don't know how long this is going to last.
We don't. National experts have suggested 8 weeks as a timeline that they expect to see the virus presence, but that is obviously clearly only a guess.
Do you happen to know the last time there was no parade?
I don't know the answer.
Parade?
Yeah.
Last time, 1950.
Councilman O'Connor said 1950 was the last one.
It's been consistent since 50.
Even just more broadly, Wendell, I know this weekend is the focus. What are you looking at beyond this week? I mean, to broaden this out even more, any other considerations? How are you monitoring this? What can happen next week, I guess?
It's not a very optimistic, we've seen in New York City where paramedics have responded to infected patients, and the paramedic units, firefighters, Kirkland, Washington, they've had to be quarantined for 2 weeks. The G7 not coming to Pittsburgh helps alleviate some of the concerns that we had as far as staffing. We are ready to go on, as Chief Lynn said, 12-hour shifts on the police if we have to cancel past days. The other problem is that you have the first responder personnel out there dealing with potentially infected people. They don't want to go home to their loved ones. So there's a lot of moving parts that we have to be concerned with. The city, the continuity of government, the plan that Kinsey Casey has been working on, whereas potentially 40% of your workforce may be incapacitated, and being able to have some of those employees work from home. So I think it's going to be a very challenging next 4 to 8 weeks, as we indicated. So, like I said, the schools, we don't know the situation on what's going to happen with the schools. So, but I feel confident that we're as prepared as we can be, and that's across public safety. Weeks ago, we handed out, each police officer has a personal protection equipment to include 2 masks and eye protection gloves. We've loaded up as much as we can with additional personal protection equipment on the fire units and the medic units. It's probably going to become a 24-hour, 7-day-a-week to make sure, because one patient, it's going to eat up a lot of your PPE and go through it. And so I think we're in for a very hard next several weeks. And it's just a matter of when the case hits Allegheny County in western Pennsylvania. And it very well could already be here and we don't know it, so.
What's the best way for people to find out about cancellations? Do they need to just call the various groups, or is there any central?
If you're talking about a city event, the best way to get that information is by calling 311. We'll be making sure our 311 operators have all of the information about different cancellations, and of course we'll be updating websites, social media, and trying to get the word out in every way we can.
But I mean, in the city, but maybe not hosted by.
I think normally what they do for school closings during a snowstorm, and we're going to have to rely on the media and the radio stations and the internet. I think it'll be similar to what is done during adverse weather.